Good, happy Tuesday morning, April 28th, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. It's good to be back on air after a couple days off of doing the newscast. Good to be back here with all of you. I hope you had a wonderful weekend and had a wonderful Monday yesterday. Happy Tuesday, everyone, and welcome to the Riley King Newscast. Let's begin with your news. We have a lot of news to get to this Tuesday morning. First up, state aims to open testing for anyone with COVID-19 symptoms. There are 1,938 known coronavirus cases in New Hampshire, officials report. Let's take a listen to that video from WMUR News 9.
Chapel Tractor has been in our family since 1955, when great-grandfather Pearlie and grandfather George decided to sell tractors out of their barn, with a work ethic geared towards customer satisfaction and loyalty.
Governor Sununu says New Hampshire is currently averaging about 1,000 tests a day for COVID-19. But thanks to increased lab capacity, the state now wants to test 1,500 people per day.
The goal is to make it as easy as possible to test residents close to home and ensure that a more complete and comprehensive map of COVID throughout the state is available.
5 new testing locations will be set up in Claremont, Lancaster, Plymouth, Tamworth, and Rochester.
To fill the gap for Granite Staters not able to access hospital-based clinics or urgent care centers.
Testing of long-term care facility employees in Rockingham and Hillsborough counties will be expanded to the rest of the state. And health leaders now recommend you call your physician if you're experiencing any mild symptoms that could be COVID-related.
We'll call you back and we will set up the location that's nearest you and an appointment to come and get your specimen collected.
The sooner the state gets more test results, the sooner officials will have the necessary data to start reopening the economy. New Hampshire's stay-at-home order is in effect at least until May 4th. But Sununu says factors like the health crisis in Massachusetts makes it difficult to consider lifting that order.
I don't think that's going away after the 4th, but we may be able to come back and augment it and adjust it and try to create some flexibilities there.
Sununu says the state will offer a full presentation later on this week on what's next in New Hampshire, including how to start to reopen. Reporting live in Concord, Mike Cronin, WMUR News 9.
Okay, and there you go on that video and that report. And now let's take a look at your COVID-19 information in New Hampshire, what you need to know. And here is a look at the COVID-19 in New Hampshire, what you need to know. There are 1,938 number of people in New Hampshire who have tested positive for COVID-19. There are 1,008,43 number of people in the United States who have tested positive. 60 number of deaths from COVID-19 in New Hampshire. 246 number of people who have been hospitalized with COVID-19 in New Hampshire, and 56,649 number of deaths from COVID-19 in the United States. This map of New Hampshire shows you where cases of COVID-19 are in New Hampshire in towns and cities. Manchester, 405 cases of COVID-19. This chart here shows you new cases each day in New Hampshire. In the purple, daily new positive COVID-19 cases. In the orange, new hospitalizations. And in the red are the deaths. Why don't the numbers add up? Here is why. Current cases. In the purple, total current COVID-19 cases. And in the orange, current hospitalizations. Cumulative totals. in the purple, total positive COVID-19 cases in the orange, total hospitalizations in the red, deaths in the blue, recovered. By age group, by sex, and risk information. Race/ethnicity of cases in percent of New Hampshire population. And again, your common symptoms: fever, lack of smell, cough, and difficult breathing. How it spreads, and prevention tips. Be sure to stay with the Riley King Network for the latest of your COVID-19 information. Laconia Motorcycle Week postponed to August. Let's take a listen to that video from WMUR News 9.
Chapel Tractor has been in our family since 1955, when great-grandfather Pearlie and grandfather George decided.
We do begin tonight with breaking news. Motorcycle Week has been postponed.
Tonight, the Laconia City Council voting to move the June event to August 22nd through the 30th because of the coronavirus outbreak.
Okay, and there you go on that video and that report. So again, it will be from August 22nd to the 30th this year, unless it gets canceled or something due to this virus. We'll have to see how the summer rolls out. Nurse from Elliott Hospital returns from treating COVID-19 patients in New Hampshire. Nurse for 3 decades. Let's take a listen to that video from WMUR News 9.
Some work can't stop because our communities need you, which is why we're working to keep you working, to help you keep home.
Since the outbreak of COVID-19, Rachel Shields has been watching the developments closely, especially the devastation in New York City.
I've been a nurse for almost 32 years. I can't explain it to anyone, but feeling the need to go and do what I could.
She volunteered her time to help at Queen's Hospital, working 12-hour shifts for 21 days.
I was actually very nervous going to the floor because all the patients were behind solid wooden doors, so you couldn't see them.
She says the patients she cared for were extremely sick.
They struggle to breathe, and to me it looks like they have air hunger. They just need some oxygen, and you can see it in their eyes, the fear in their eyes. I did take the time to speak to them, to try to calm them, to just, pat their shoulder and tell them, I'm here to help you. And I do feel that really helped some of these people who are in such distress.
She found support through her family, friends, and fellow nurses to make it through.
I didn't know if I could actually stay there the whole 3 weeks. There was many people who left after a few days.
But she stuck it out, and this was waiting for her when she got home on Monday.
My family, my friends, my neighbors, with balloons and cheering and signs, with food. It was overwhelming for me. It was surreal. I didn't feel it was me there. I really didn't.
Rachel tells us she will be quarantining for the next 14 days, time she will certainly use to rest. Reporting in Manchester, Kristen Carosa, WMUR News 9.
Okay, and there you go on that video and that report. Child abuse and neglection reports remain down. Experts say numbers are not reflecting reality. DCYF using telehealth PPE for in-person check-ins. Let's take a listen to that video from WMUR News 9.
Let's pray.
As we all hunker down in these tough times, there's still work to be done. And Mahindra is here.
Just as schools and children have settled into online learning, DCYF has shifted gears to video conferencing for most check-ins with kids and families. But for those deemed higher risk, the director says there's finally enough PPE to make in-person meetings safer.
We're trying to really just encourage staff to first just stay outside and conduct your interviews outside and don't ever get into close contact. Just, manage it that way.
He says if they do go inside, they should wear masks, but that close contact is rare.
If there was a situation where we had to do a removal, we had to actually, remove a child, we're asking staff to wear, masks, gloves, and gowns.
Meantime, experts say reporting doesn't reflect what's likely happening at home. The week of March 1st, 600 reports came in. By mid-March, when schools closed, 335. A month later, still about half.
We know that in times of crisis like this, there's a higher incidence of, domestic violence and abuse and neglect.
The stay-at-home order means far fewer contacts with teachers and others who normally report.
So that's the issue. We're not seeing it, and we want to make sure that we can actually hear if that happens, and that's why we sort of decided to start this, family support warm line.
The call is on for the community to be actively engaged in the families in its own midst, neighbors looking in on neighbors and pointing them to resources that are there, like the Family Support Warm Line. We have information and links on our website. Live in Portsmouth, Jennifer Crompton, WMUR News 9.
Okay, and there you go on that video and that report. Newmarket Community Church pastor will sleep in steeple to raise funds for community. Steeple bell rings every hour. Let's take a listen to that video from WMUR News 9.
Let's pray.
As we all hunker down in these tough times, there's still work to be done. And Mahindra.
If Pastor Patty Marsden has her way, she will spend one night way up there in the steeple of the Newmarket Community Church.
So when do you plan to do this?
Well, after we raise $8,500.
The church live-streamed Easter services from the steeple. Now Pastor Patty says she'll sleep in the steeple to raise funds, not for the church, but for their community projects, like the thrift store and food pantry.
I'm not sure you're going to sleep very much.
I don't think I'm going to sleep at all. The bell rings every hour.
The bell rings in good times and bad, a constant symbol looking out over the Lamprey River.
There's a lot of talk in town about the bell ringing, and it's home to a lot of people. It's comforting.
Support is pouring in. A scouting troop is providing camping equipment. Donations are coming in on the church website and Facebook page. Even a note that touched Pastor Patty's heart.
And she wrote to me and she said, I'm donating to this sleeping in the steeple, which is crazy. And, I'm inspired by your tenacity, but more than that, you bring us hope. And I was like, yeah, it's really not really just about the money, of course. It's really about if it brings people together. These are tough times, and bringing people hope is really what we're all about. So I'm really happy to do it for a night.
Jean Mackin, WMUR News 9.
Okay, and there you go on that video and that report. Dow futures raise more than 200 points as oil prices continue to fall. U.S. stock futures were higher on Tuesday as oil prices continued to fall after plunging in the previous session. North Korea leader is MIA. Let's take a listen to that video from ABC News.
And next, the mysterious absence of North Korea's Kim Jong-un. The dictator has been out of view for more than 2 weeks at this point, sparking rumors that he's sick or even may have passed away. ABC's chief global affairs correspondent Martha Raddatz joins us now. Martha, what do we know about his whereabouts?
Well, you know, Lindsay, President Trump was just asked about this, and he said he knows, relatively speaking. He said, I just can't tell you exactly. I do have a good idea, but can't talk about it. Meanwhile, a senior U.S. defense official tells me that reports that he is dead or gravely ill are, as the source said, hogwash, but there is this satellite image, a kind of fascinating satellite image from Planet Labs 38 North that shows a long train outside of one of Kim's compounds. We all know he's been on those trains many times, that luxury train that took him to Vietnam. But at this point, we really don't have any more information. There is clearly something going on. He's out of view, but back in 2014, he also disappeared for about 6 weeks, turned up with a cane and said he had had ankle surgery. So we don't know exactly. It could have something to do with COVID-19, although North Korea says they have had no cases. But, Lindsay, that is impossible to believe.
All right, we will stand by for news. Martha Raddatz, our thanks to you.
You bet.
Okay, and there you go on that video and that report. And that is it for this morning edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your morning and a great rest of your day. I'll see you back here later on today for another newscast. I'll have a news report coming up in a little bit. Goodbye, everyone.